well dressed in Mercy apparel, with her jacket, which is appropriate for the season for wintertime in this coal house. She's clean, well put together. Her skin color is pale and pasty, which is appropriate for the winter time. Her posture is good. She's sitting nice and tall. She's holding her shoulders back. She looks like she has pride in herself and carries herself well. She has a good affect. She has a good mood for the situation that she's in. Her speech, we will assess here to make sure it's clear. Austin, are you having any hearing difficulties?
No.
Are you having any speech problems?
No.
I hear a little bit of a lisp. Is that something that is?
I have new retainers.
You have new retainers. Okay, so Austin's working on her physical appearance with retainers, or Invisalign, it looks like. And Austin, how's your appetite been? Have you noticed any weight loss or gains recently, or had any problems with your diet?
Been about the same.
Been about the same. Okay. What's your diet usually consist of? Is it a fairly nutritious diet, or is it mainly consist of
but tonight
Oreos?
I ate Chinese food and Oreos for dinner.
Chinese food and Oreos. So we'll provide her a little education later on about some healthy food choices, primarily to stay away from Chinese chicken and Oreos. So first we're gonna start with head and face assessment. She maintains eye contact with me as I enter the room and start my observation of her. She's oriented, it seems like. Austin, do you know where you are this evening?
I'm at home.
Okay. Hopefully you're in the hospital.
I'm in the hospital.
Okay, so she may be slightly confused at this point. We'll have to look into that. Do you know what today's date is?
It is February 4th, 2016.
Okay. And do you know why you're in the hospital?
I'm here for a checkup. I'm not in the hospital.
Okay,
I'm
so
at
you're
my
in the
doctor's
clinic.
office. Yeah.
Okay.
That's where I am.
Okay, you're in the clinic. Okay, so Austin is in the clinic with us today. Okay, so first of all, I'm going to ask you if you'll let down your hair for me. I am going to perform a inspection on her head and her scalp. Sorry, I apologize. Alright, so I'm going to put on my gloves after I perform hand hygiene. Is it alright if I touch your head? Alright, so first I'm going to feel her head, feel for any abnormalities, bumps, lesions. I'm going to look for any bruising. Her hair looks good. There's a slight bit of graying, but I'm unfortunately looking for any bugs as well, in case she may have lice or something. But I don't see any bruising. I don't feel any lesions. Have you had any headaches recently?
No.
Have you ever had a head injury of any sort,
No
or
head
surgeries
injuries.
on your?
No.
Okay. So now I'm going to observe her face. I'm going to look for symmetry from side to side between her eyebrows and her eyes and her mouth. Look for any facial droop or any scars or any sign of any nerve damage. Her ears are level from side to side. Let's see. Next, I'm going to feel the temporal artery here. That feels good. I'm going to feel her joint here, her mandibular joint. Can you open and close your mouth for me? Do you have any popping?
No.
No, doesn't feel like it. Okay. And do you have any, are you having any sinus issues?
I have some pressure.
Some pressure right in here? Okay. Alrighty. So now I am going to assess Austin's eyes. I'm going to assess her peripheral vision, and her reflexes as well, and some of her nerves. We'll also perform a cover test, and we'll talk through the Snellen eye chart here. I'm going to go ahead and pull out my pen light. We'll use this here in a minute. So I'm going to test your peripheral vision now. And if you'll just look straight ahead and just tell me when you see my fingers come into view. You can see them? Okay, good deal. So she has good peripheral vision. I'm going to check her corneas and pupil reflex now. So I'm going to shine a bright light in your eye. If you'll just look straight ahead for me. I'm going to check to make sure this left pupil constricts. I'm going to look at the right pupil. It constricts as well. And I'm going to check to make sure that the right pupil constricts when I shine the light in the left eye as well. Alright, so both pupils are equal around interact to light and accommodation. Are you having any double vision or pain with your eyes or anything? No? Okay. So now we're going to check her eye movement. I'm going to just have you follow my finger just with your eyes, not moving your head at all. So now we're going to test her eyes with our finger moving towards her. So you may go cross-eyed here a little bit. So just focus on my finger as it comes into you. All right, great, good deal. So now we're going to do the cover test. I'm going to ask you to just cover your left eye first with one eye and just stare straight ahead for me. And then I'll ask you to remove your hand. And here I'm looking to see if we'll try it again here. If you can still look straight ahead for me. Are we looking for any drift between the eye that's covered to see if it drifts off as she looks straight ahead? Okay, good. And the eyes stay straight. Now we'll try the other side and go ahead and remove it. And her eyes stayed straight. The one that was covered up did not drift at all. Now I'm going to look at the external structures of her eye. I'm going to check the sclera, conjunctiva, make sure there's no scleral edema or anything such as that. Just look straight ahead for me. Her eyes look good. They're slightly reddened. Austin, do you have any allergies? So, potential allergy there with her eyes being reddened.
And I'm tired. When I'm too sleepy, they get bloodshot really easily.
Okay. So, she is tired. Have you worked today? Okay, so looks like she's coming off of work, pretty sleepy and tired, so that mixed with some allergies may cause some eye irritation there. So now we're going to look at the Snellen eye chart. We're going to act like there's a eye chart in front of Austin here. Alright, so we're going to act like there's an eye chart in front of Austin here. And she's going to stand 20 feet away from it. And Austin, if you'll just read me the letters from the top of the chart down as far as you can.
K-L-O-A-M-N-C-D-E.
Okay, good deal. So Austin looks like she has perfect 20/20 vision with her Snellen eye chart test. Next, we're going to inspect her ears. Upon initial inspection when we entered the room, her ears didn't appear to have any deformities. They are relatively small to her head, it appears. I'm just kidding, her ears are fine. So we're just going to observe each ear to make sure there's no lesions or rash or any drainage coming from it. Make sure ear piercings aren't maybe possibly infected. Everything appears fine with her ears. I'm going to observe her ear canal I don't necessarily have an otoscope, but I do have a pen light, and I'm gonna still run through the motions of that. On an adult, I'm gonna grab the ear here and pull up and back and gently insert my otoscope, and you may feel a little pressure here. I can visualize the tympanic membrane. It's pearly gray, there's no punctures, there's no irritation. And I'm gonna go ahead and observe this on the other side as well. And the same results over here, pearly gray tympanic membrane. Next we'll inspect her nose. It looks symmetrical. Have you had any nosebleeds or any drainage from your nose with your sinus pressure or anything?
The drainage, just every once in a while with my allergies.
Drainage with your allergies, okay. Does one nose feel clogged or anything like it's blocked off? I'm just going to look inside here. Sorry about the bright light. Each nostril looks like it remains free from obstruction. Her nose is nice and symmetrical. Let's see, next we'll take a look at her mouth and her throat. If you wouldn't mind just opening for me, I'm just gonna look inside for any lesions with my light here. I don't see any. Everything looks good. The tongue looks good. Can you stick your tongue out for me? Looks good. There's no lesions on the tongue or anything. Sorry about the bright light. Can you lift your tongue up to the roof of your mouth? Okay. Now stick your tongue out and say ah. I'm going to visualize the tonsils and the uvula to make sure it's centered. Okay. One more time for me. Uvula is centered. Tonsils don't look inflamed. Everything looks centered. Looks good. Thank you. Teeth are all intact. Gums look good. They're not bloody or puffy. Let's see. The tongue is centered with no lesions. The floor of her mouth looks good with no lesions. The uvula looks like a normal uvula. It's not deviated to one side or the other. Tonsils are not inflamed. They're not reddened at all. Patient does report to have a good gag reflex. She can stick her tongue out. Can you stick her tongue out and move it side to side and up and down for me? She has full range of motion with her tongue, so no issues there. So now I'm just gonna inspect your neck, if you don't mind. I'm just gonna feel here, feel lymph nodes. So she's reporting some soreness here on her lower jaw and the top of her neck here. I don't feel any swollen lymph nodes or anything, but we'll take a look into that. I'm gonna feel back here on her neck, feel for any lesions or masses or anything. Everything feels normal. Do you have any neck pain? No? Okay. I don't see any jugular venous distension. I'm going to check her pulse here real quick through her carotid. She's got a nice strong pulse. Can you turn your head from side to side? Touch your chin to your chest. Tilt your head back. And can you tilt it side to side? Okay, good. Any pain? No? Okay. I'm just going to feel your trachea here. You turn your head towards me. Okay. Other side. Okay. That feels good. And I'm going to feel your thyroid here. Doesn't feel enlarged at all. Range of motion's good. I'm just going to have you, just going to test the muscles of your neck. I'm going to place my hand on your forehead and have you push forward on the back and then side to side. So you push forward for me, okay? Back, okay? Side, okay? And side, okay? She's got good muscle strength there. And thank you, Austin, for coming into the clinic today and being such a good participant with my exam. And that concludes my head, eyes, ears, nose, and throat exam. Thank you.